I want everyone to be respectful of those around them. So if someone does decide to disclose something about their identity or about their experiences, what I like to say is what's learned here leaves here, but what's said here stays here. So it would be inappropriate to disclose that person's identity, to say like, oh, Kiana, who works at the CCGC, she has short hair and she moves her hands around a lot. She said this about her experience. That would be inappropriate. What would be appropriate is to say like, I learned something about someone who identifies within X, Y, and Z community. And then lastly, I just wanted to let you all know that we are going to record this session. So if you do feel uncomfortable either sharing or having your video on, just know that we are recording. So feel free to turn your video off. You can also change your name through Zoom, even though the Zoom will mostly focus just on my screen and the speaker view. So just be aware of that we are recording right now, just in case that changes how you would like to disclose. And then, are we cool recording, Esteban?
Yes.
Okay, cool. Awesome. So a brief land acknowledgement. So the Fresno State campus sits in the midst of the San Joaquin Valley, a valley rich in the traditions and representation of Native American peoples and culture. We are grateful to be in the traditional homelands of the Yokuts and Mono peoples, whose diverse tribal communities share stewardship over this land. If you want to know more about the land acknowledgement and the land that we live on, I encourage you to visit the link right here, or you could just Google land acknowledgement Fresno State and more information will pop. And then something else that I also wanted to mention in the introduction very briefly is that I am 22 years old. I'm newly 22 years old, which means I was born in 1998. So a lot of the things that I'm going to talk about, I wasn't around for. I'm not someone who directly experienced this. So I'm really introducing this to y'all as someone who did research, which I guess what is the word, a very amateur historian. I'm sharing what I have learned through my experiences, but of course I am not directly an expert. If there's anyone in the room that would like to share their personal experiences, I would, welcome that. Just please indicate that in the chat and we can make some space for you. But I do want to be very transparent that I'm 22 years old. Of course, I'm not going to know what the 80s or early 90s were like. We're just sharing some general information. So what is HIV and AIDS? So HIV stands for human immunodeficiency virus. So it's a virus that attacks the cells that help the body fight infection. It makes a person more vulnerable to other infections and diseases. It's spread by contact with certain bodies of a person with HIV, most commonly during unprotected sex, so sex without a condom, or HIV medication to prevent or treat HIV, so like PrEP or PrEP, pre-exposure prophylaxis or post-exposure prophylaxis, or the sharing of injection drug equipment. I like to kind of just clarify what HIV and AIDS are because there is a lot of misconception about what it is and how it spreads. So of course here it says that certain bodily fluids, and so blood is the number one, but there was a large misconception and still seems to be a large misconception that it can be spread through saliva and that it could be spread through touch. So if you're around someone who is HIV positive and you're just, shaking hands, high five, of course it's not going to spread in that way. So it's certain bodily fluids. And AIDS is a late stage of HIV infection that occurs through when the body's immune system is badly damaged because of the virus. So that's the difference between HIV and AIDS. So HIV is the virus and AIDS is the late stage of HIV. And what does this have to do with the LGBTQ+ community? So you might have heard of AIDS and HIV, and maybe this is something that you either indirectly attributed to the queer and trans community, or maybe this is something that maybe you knew if that largely affected the queer and trans community. But really when we think about that, we have to think about who is the most affected by HIV and AIDS. So gay and bisexual men have the largest number of new diagnoses in the United States. African Americans and Latinos are disproportionately affected by HIV as compared to other racial and ethnic groups. So men of color are the most affected by this. Also, transgender women who have sex with men are among the groups of the highest risk of HIV infection. Injection drug users remain significant risk of getting HIV as well. Anal sex is the highest risk sexual behavior. The second to that is vaginal sex. So anal sex is the complete highest risk sexual behavior that could that would occur to the transmission. And so when we talk about HIV and AIDS, it kind of lends us into talking about the AIDS crisis. So in the summer of 1981, an unnamed immunodeficiency disease began to affect these clusters of gay men. It almost seemed randomly, and it was reported by the CDC. It's later classified as AIDS, but it was beginning to be known as the gay cancer because it was essentially just a random disease that nobody understood. And the only thing that people knew is that it was affecting gay individuals. By the end of 1981, there was a total of 337 reported cases of individuals with severe immunodeficiency in the United States, 321 adults and adolescents, and 16 children under the age of 13. Of those cases, 130 were already dead by December 31st. So that's from the June of 1981 to December 1st of 1981. So when we talk about this, we have to also kind of think of how were these patients being treated? This was known as a gay cancer. So the first compassionate holistic AIDS care unit was Ward 5B. So this ward was created, and it was the first one that was ever created specifically for those affected by HIV/AIDS. But this was the first one ever created, and this kind of paved the way for a holistic caring treatment of HIV patients. A lot of the times medical professionals wouldn't want to treat those that had AIDS because they didn't know if they would get it, they didn't understand it, and they also didn't have a general compassion for those who were identifying as LGBTQ+. So when we think about that, a lot of these medical professionals that would disregard LGBTQ+ patients or patients who were dying of AIDS, there was a small minority that really did care about the care of AIDS patients, and so that came to be Ward 5B. We would see doctors and nurses holding the hands of patients, which was really revolutionary during the time because they thought it was spread by touch. They thought it was spread by being around one another. But these doctors and these nurses would take a risk because they didn't really know much. They would take a risk because they saw that these people were dying alone. So we can almost see a little bit of a parallel between COVID-19 and HIV, which is really interesting. Thousands were dying, but the current administration, which was Ronald Reagan, made very little movement to fund research and policy. So what would happen is that these people were dying in mass. We had, during the entire Reagan administration, we had folks that were trying to advocate for more funding for research to figure out, what is this disease? How does it happen? How is it spread? How can we create treatment and prevention plans, but really there was very limited funding coming from the Reagan administration. Another large thing was when we talk about the way that AIDS or HIV can be transmitted is through intravenous drug uses, which could be used by needles. And so what was being pushed is having some safe places for individuals to dispose of or to essentially get rid of their needles. But the Reagan administration essentially just refused to fund cities to be able to dispose of needles properly or to exchange needles. And so instead, folks who were using the needles would share them with other people, and that would just continue the spread of the disease. They just really, didn't want to fund anything that was related to drugs, or didn't want to fund anything that would, continue, quote unquote, the drug use. But that was one of the main policies that the Reagan administration essentially refused to fund. By 1998, which is when I was born, the known death toll was over 400,000. Just kind of let that sink in. And so when we talk about where we were versus where we are now, a very big organization was ACT UP. So in 1987, activist Larry Kramer founded ACT UP. It was a direct action group advocating for the government, health and pharmaceutical agencies to protect those with HIV/AIDS. Here's a quote. It says, Time magazine calls ACT UP the most effective health activist group in history for pressuring drug companies, government agencies, and other powers that stood in their way to find better treatments for people with AIDS, and in the process, improving the way that drugs are tested and approved in the United States. So essentially, these activists were seeing the injustices that were happening, specifically against queer and trans individuals of color. And they fought against it. And so this photo here is of Larry Kramer. And so essentially Larry Kramer saw that his community was dying. He would walk down the street and people would stop him and say, did you hear so-and-so died? And that would happen every time that he would walk down the street. A lot of folks, a lot of individuals who were, alive during this time or who were within their adolescence during this time could name at least 5, if not hundreds of people that they knew that passed away because of AIDS. And so this was a complete injustice against the queer and trans community. We didn't have government funding. The health organizations and pharmaceutical agencies were not putting pressure on this. If you really think about it, the first case that was reported, of course, like I said, was in 1981. And then we had this large number in 1998 of 400,000 of those who have passed away, not just infected, but passed away. So that's a large injustice against the community. And so thinking about that, not only as just like, oh, this is like a health thing, but as an injustice against a minority group. And so here are some of the images from some ACT UP protests. So during the 1982 Pride Parade, which was in, I think, San Francisco in this photo, ACT UP actually came, not ACT UP, but one of the organizations came to the Pride Parade to hand out pamphlets that gave out some information about HIV, because the government wasn't doing it. The government was not doing public health announcements. So grassroots movements were the ones that were essentially spreading the word and letting folks know that this is something that was happening. What would happen is that this was the headquarters of the FDA. And so ACT UP, the organization, would lay down in front of the FDA and essentially host a die-in. So they would lay on the floor and hold up these gravestones and essentially representing their lost siblings, their last queer and trans siblings that died from a lack of drugs and a lack of representation and a lack of care from our government and our health agencies. And so you would see a lot of these protests happen over the next decade. And then I just wanted to add before we move on from ACT UP, because this is such a large organization that was probably one of the most influential within the past century. I just wanted to add that I read a lot of articles about Larry Kramer, and now, we have, Anthony Fauci, which is one of the main folks that we see on the news now. Larry Kramer and that doctor, were actually very close. Larry Kramer would go on the news and essentially yell at him and say, you are not representing our community. You are not, making the movement that we need. Like, my people are dying. And that actually developed a very close relationship between them. And there is a quote from that doctor that said, I don't think that we would be where we are today if it wasn't for ACT UP and if it wasn't for Larry Kramer and other grassroots movements that really pushed the government to make these changes that were radical and they were demanding things. So here's a summary provided by one of our faculty members, Dr. Sullivan. I'm not sure if he's here because I can't see anything, but hi, Dr. Sullivan, if you're here. That was provided of HIV and AIDS cases within Fresno County. So most new cases of HIV transmission in 2019 have been linked to men who have sex with men, MSM. The remaining 15% of new cases are linked to intravenous drug uses, IDU, or adult heterosexual contact. I saw something very interesting just the other day within a World AIDS Day post posted by one of our community members. And it said that in Tulare County, the number one group of individuals that are affected by HIV transmission are heterosexual women. So it's not just siloed to the LGBTQ plus community. It's not just siloed to men who have sex with men or men of color. This affects or can affect everyone. And then about 50% of new cases of HIV in Fresno County occurred in individuals under the age of 35. And there are about 100 to 160 new HIV infections each year in Fresno County. New HIV cases peaked in 2017 at just under 160 new cases. So it tends to be pretty high. Just gonna leave y'all some time to take a look at the chart. So I wanted to share with y'all a very, I thought, interesting video. It's called Gay, Black, and HIV Positive. So if you can go ahead and just turn your attention to the video, I'm just going to play it and then we'll move on to our next slides. But essentially it's just to emphasize the fact that the HIV epidemic is not over. The HIV crisis isn't over. There are communities of color that are disproportionately affected. So I'm just gonna go ahead and play this video, and please let me know if anyone, actually I'll just turn them on anyways, the captions.
It is Mecca, it's Wakanda, it is a refuge. If you live in the South and you happen to be Black and be gay, this is as free a city as you're gonna find. I think it's the greatest place on earth.
When I moved here, I was like, oh, thank God, yeah. I'm gonna have a new, clean slate. I can reinvent myself. I'm able to be comfortable in my own skin.
You have all these Black gay men rushing to Atlanta, and Atlanta is not the land of milk and honey they thought it was gonna be.
Who thinks that they're going to be diagnosed with an illness that could possibly kill you, that you may not see 30 or you may not see 40?
White America believes this is over.
I mean, you actually hear people say the height of the epidemic. There is no way that 1989 was the fucking height.
We're not just gonna sit back and watch our brothers die. We're gonna do something about it.
If you're a gay Black man in America today, your risk of contracting HIV is 1 in 2. I've come to Atlanta, Georgia. Long seen as a mecca for gay Black men, thousands move here each year from across the country to start a new life.
All right, so y'all, I'm finna do a little dance for y'all. It's a little J set.
This is 25-year-old Darian, who moved to Atlanta from Huntsville, Alabama in 2014.
So it started like this. So we'll do it one more time. I came out in 7th grade in middle school. I had this crush on this guy, and someone told him I had a crush on him. So he went back and told his mom, who told the principal, who told my parents. And then he called me into the principal's office and was like, we don't accept that going on in our school. For my stepdad, he was like, he's from that hood, urban side of town. He was like, if I hear one more thing about you being gay, I'll ship you back to your dad.
How old were you when that happened?
I want to say 13, 14.
At the age of 21, Darian left the conservative city for Atlanta, where he could live freely as a gay man. Are you different now, do you think, than the Darian that lived in Alabama?
Yes. I was very shy. Growing up, I was antisocial. I was very skinny, like a twig. When I moved here, I started working out more just to build my muscle up. Started getting tattoos everywhere. I feel like when I say I was gonna revamp myself, I really revamped myself. So I like the new me.
After 3 years in the city, he contracted HIV.
I was feeling very sick. So I remember leaving work, went to the doctor's office, and they said, okay, you have gonorrhea and acute HIV. I was so shocked. I just started thinking, why me? I was just break down crying. It's like, Darian, how did you get yourself to this point where you contracted HIV?
So had you been using condoms consistently before this happened?
A few times, like I want to say 2 or 3 times, I would slip up and not use them. But I would get tested on a regular basis. I would go get tested from 3 to 6 months. And every time I got tested, it was negative. So I wasn't really worried about it.
Like many young people, Darian was careless with condoms 2 or 3 times. But unlike most young people, his risk of HIV was so high because of who he is and where he is. I've come to meet Tori Cooper, an HIV prevention specialist on the front line of the epidemic in Atlanta.
Some people like black condoms. Some people like non-latex condoms. Some people like insertive condoms. Some people like the larger condoms. A personal favorite, have you ever seen this before?
I have not.
So it's an FC2, and this is a condom. I want you to open. We're gonna open one together. This is great because it goes inside of the receptive partner. And I always tell people, if your partner is bigger around than that, then you probably should not date him. All right? So.
How much more at risk of contracting HIV are you as a black gay man than a white gay man?
So a black gay man in the South, his chances of getting HIV are about 1 out of 2. For white gay men, it's closer to around 1 out of 11. So that's really a startling statistic. Sometimes because of their skin color, they have access to certain things that black gay men don't generally. I'm generalizing here. And sometimes that includes access to stuff like PrEP, which stands for pre-exposure prophylaxis. And that's for people who are HIV negative. It's a pill that they take once a day that keeps them HIV negative. It keeps them from getting HIV. And what we're finding is, as PrEP continues to roll out, there are a lot more people who are white, who may not be as high risk, who have access to PrEP. If you're someone for whom 85% of the billboards are targeting you, they have pictures of you on there, then you start to realize, hey, this is a message for me. We've had 35 years of messaging for white gay men. They've gotten it, or at least they're getting it, and they're far ahead than everybody else.
Lower rates of health access, education and income have all been found to play a role in the HIV rate among gay African-American men. But these systematic and historical factors are not enough to persuade everyone. Some people place the blame for the HIV epidemic solely on the gay black men living through it.
We live in an era where the morals have vanished out here, and everybody's fucking and sucking everything they can get their hands on.
This is Walter Lee Hampton II, a controversial YouTuber on Atlanta's gay scene. As someone who is HIV negative, he's often accused of demonizing gay black men and ignoring the evidence of what's really behind America's HIV problem. How do you explain the fact that it's still such a problem in the black community and not in the white community? Because for a lot of people that shows that it isn't just about behaviour, it's about things like healthcare and education.
I'm a member of the black gay community. I understand and I see what's going on, and it's unfortunate what I see going on in our community. These guys are not trying to build relationships. White guys are more prone to get into relationships.
I mean, I don't know if that's true.
Well, I know it's true.
If there have been studies done that show that black gay men actually have fewer sexual partners than white gay men.
Well, nobody's going to walk into a study, talk to a person who's taking a study and say, well, you know, I just slept with 5 people in the past 48 hours. People are not going to tell the truth. I know what these guys are doing.
This is like an America-wide study that shows that black men engage in less risky sexual behavior, have fewer partners.
I would take that study and toss it into the trash can. And I'm being very serious with you, because I know that's not accurate. I talk to too many people nationwide who tell me partner after partner has insisted that they do not have protected sex. They want
unprotected sex. But maybe that's the same
sex.
in the white community.
Well, it could be the same in the white community. I can't tell you nothing about what's going on in white America.
So in white America,
I don't know anything.
Men have more sexual partners than black men.
I don't know anything about
just
that.
As likely to use a condom.
I couldn't tell you anything about their sexual practice because I'm not a white man.
My point is, if the sexual behavior doesn't differ, Why is the problem so big in the black community? Is it not something systematic that's happening as well as this promiscuity that you see?
When you say systematic, you think somebody's out there injecting these guys with HIV?
No.
Okay, so when you say systematic, what do you mean? Explain it to me.
I mean education, access to healthcare, historical interventions being targeted at the white community. There are a lot of factors that a lot of other people see.
Yeah. Well, because I'm black and gay, and I've sat here in Atlanta since 1989, and I've witnessed and watched friends all over the United States within the black gay community, I can honestly say promiscuous, risky sexual behavior is the problem. That is the problem.
All right, so this is my HIV medicine. I take one a day.
What would happen if you didn't stick to this?
If you don't take your medicine, you will develop AIDS, and they will really kill you. So if you take your medicine, eat right, live right, you keep your T cells higher and your viral loads down. And with that, you'll be able to maintain a HIV positive, undetectable status.
What does it mean to have an undetectable viral load?
You're not able to transmit the virus to somebody else.
So if you're undetectable as you are now, if you sleep with somebody, even unprotected, they would not get HIV.
Mm-hmm.
So it's basically impossible for you to transmit HIV to anybody else right now.
Most of the time, my medicine, there's no way they can get it.
Mm-hmm.
There's no way.
How much does it cost?
Ooh, it costs a lot. But there's different programs out there. Like this costs $2,000 per bottle. Yeah, $2,000.
In the months following his diagnosis, Darian has joined a group called Thrive. They hold regular meetups where gay black men socialise and talk about their experiences living with HIV. Darian is one of their youngest and newest members.
Some of us were just diagnosed last summer, and some of us have been living with HIV 3+ decades. So if anybody can speak to like...
The stigma then was so thick because families were rejecting them. Preachers were preaching that this was God's plague. I had friends dying and the church would not do their services. We would have memorial services in bars in our backyards because they wouldn't do it. And then with the medicine, making people so sick, a lot of people wouldn't take the medicine. I wouldn't take it. I took AZT for 2 days. I said, no, if I'm going out, bring me a bottle of scotch. I'm going to go out with a bang.
Well, for me, being newly diagnosed, I was like kind of scared at first. My mom, she's a registered nurse, so she sees this all the time, and she would keep preaching to me, make sure you wrap it up. So she was the first one I told, and I was kind of, I feel like I slapped her in the face.
I get angry because I feel like my generation didn't do enough to protect you. That's just me. The first thing that goes through my mind is you should not be positive, and young men should not be leaving this planet with AIDS, with this disease.
White people, or white men specifically, aren't getting it as much, so the response is totally watered down. When we think about all of the other things that affect black men, that, you know, when we do the what if around them, so like what if said thing, what if police brutality were happening against mostly white men, what would the response be then? The onus is always on us. You should have done more to avoid you getting it. We don't challenge or question the systems that are set up that leave us predisposed to getting HIV.
I believe she was being filmed for a movie. I have to live my truth.
Support systems like Thrive are often life-saving for people living with HIV. But for the most marginalised communities, a lack of support can have dangerous consequences. For black trans women, the HIV rate is also 1 in 2. But their risk of homelessness, drug addiction and prostitution is higher. And each of these make it harder to access the HIV care they need. Hey. I met Pearl in Piedmont Park as she did her weekly outreach for the homeless women who live there.
We have jeans, short pants, sweaters, dresses, skirts. These are gift bags, which consist of condoms, lube, makeup, literature, and eyebrow pencils and all the little accessories every girl needs.
Yeah.
There's not too many organizations out there now that helping transgenders that are homeless and living with HIV. So I took it upon myself to do something like that because I was also homeless and I'm living with HIV. So I was down there with them at one point.
Were you in this park?
Yes. I was on drugs. I was out there prostituting, doing whatever it took to survive.
What do you think it is about being trans as well as black that makes people more likely to end up as homeless?
You dealing with HIV, being trans, being black. You got all them strikes against you. A lot of these trans was damaged from their homes. Parents putting them out at young ages. And I know it's gotta be a deep down hurt. So I don't think it's never over. And I think that what holds them still into that bad spot where they at.
I dribble my ass like a basketball. I dribble my ass like a basketball. Jamalani told you I was coming last season. Lemon pepper wings, fries, extra season. Gone dance, girl, get it. It's your season. Jamalani season. Jamalani season. Sleeping so good on this Tempur-Pedic. Kiss so good, had to let him eat it. Bitch so bad, had to let him eat it. I'm the girl in the picture. I'm the one when I'm with you. Let's get it.
This is my picture.
Oh. Next year, Darian will come off his mum's insurance policy, leaving him unable to pay the $2,000 a month he needs for his medicine. Through his support network, he has found out about programs that can help towards the cost. But for other young gay black men across America, these resources simply aren't there.
Right now, I feel like with that younger generation, they feel so isolated from people who has information about medicine or who can't afford medicine, so they don't take it. And that's why it's more the younger generation dying now, quicker than the ones who lived through it back in the day.
So if everybody had their viral load
low,
nobody would be catching HIV.
I think for a long time, people have simply not cared. When we talk about even the first initial cases, we forget that there were black people suffering and dying at the very beginning as well. And so we became an afterthought even from the beginning.
But I remember a time the communities rallying around young men who were dying and holding them up, to look into faces like Darian and to think, you may not be in this situation if people saw value in your life.
So I do want to take some time for us to reflect on the video. So if anyone has any comments, any reflection, could you please drop it in the chat? And then Esteban, can you go ahead and read them out for us?
Sure.
Any reflection or thoughts, or maybe even something that reflected in your own experience?
Kiana, do you think if they want to share with the voice, the audio share, is that fine too, or you want to just chat?
Yeah, no, verbal is great too. Mm-hmm.
And please note, if you want to share out loud and want us to pause the recording, we're more than happy to do that, okay?
Mm-hmm. It's good to know.
I found it interesting that white gay men contract HIV at a lot at a lesser rate than black gay men. I never really, considered what the factors were in that particular situation. The majority of the time, I just considered, promiscuity. I didn't take into fact, the socioeconomic bracket, the access to healthcare. I mean, that was really eye-opening and really informative.
Awesome.
One of the attendees shared privately that they're just unaware, of the information that was shared in that video. And another person mentioned that this is very powerful. Thank you for sharing the video.
Yeah, thank you all, and thank you, Timothy, for sharing that. I did get a question privately that asked what kind of programs are offered here in Fresno, and I think this kind of lends us kind of perfectly into our next portion. So before I move forward, I do want to leave some space if anyone else wants to unmute and share something, so I'll give some time right now. But I think this is kind of a great little transition to our next subject.
I was just like unaware and uneducated on the fact that if you are like consistently taking your HIV medicine, like you can't give it to anybody. I think I was just oblivious, and I thought like once you have HIV, everybody you have relations with like can have it too. So I thought that was interesting.
Yeah, there's a big, it's kind of catchy, campaign or slogan that says you equals you. So undetectable equals untransmittable. So folks that are, taking treatment and receiving treatment and have access to this care, get their viral levels to undetectable, and so therefore it's untransmittable, and other members of the community won't also get it. So it's something that I recently learned too, and I've been doing this work for a long time. So it's very interesting what information we don't have readily access to, if that makes sense. Anyone else want to share something before we move forward?
I was really shocked by the cost of the medicine, given that it was such like a threatening epidemic that happened decades and decades ago, and given the amount of lives it took and the impact that it still has currently, I would have thought that there'd be more social services or more of a government role in making sure that this medication was accessible. And I was just like really thrown back. And I think it's just like a reminder, right, how we said like systemic factors, as well as the industrialization and like the profits within the medicine, the field of medicine. So thank you for sharing that video.
Yeah, thank you for adding that, Rebecca, because, we refer to the past epidemic, the past crisis, when within Atlanta, for a gay Black man, it was 1 in 2. What kind of numbers are those? And then to make sure that, the community isn't widespread affected by this, that means they have to shell out $2,000 per bottle for medicine that is literally life-saving. I think we could all be upset and talk about this for a long time, but thank you so much for pointing that out. So all of your questions or comments were really awesome and kind of lend us very smoothly into our next portion. So I'm going to go ahead and invite Ernesto from Planned Parenthood Marmonte to talk about their organization and about some resources in Fresno. So go ahead, Ernesto.
Cool, thank you so much. Can you hear me okay? Yeah, all right, cool. So my name is Ernesto Saavedra. I'm the grassroots organizer with Planned Parenthood Marmonte, based out of Fresno. Gonna talk, like Yana was saying, it was a perfect transition into, what work has been done here specifically in the Central Valley, and also like just doing research just for this presentation myself. I learned a lot about just the movement here locally, and like I mentioned, other stuff that has been going on here. So it's a cool little history piece to get into. So Planned Parenthood Marmonte, so our mission is to invest in communities by providing healthcare, education, and expanding rights and access for all. We are the largest Planned Parenthood affiliate in the United States. We have over 30 health centers covering everywhere from the Silicon Valley to Reno, Nevada. So we cover a big area of California and a fairly good size of Nevada. Here in the Valley, we cover Stanislaus, Merced, Madera, Fresno, Tulare, and Kern counties. And some of the services that we provide, they're not all listed here, but these are pretty much like the standard ones. Birth control, pregnancy testing, and options counseling, STD, or better known now as STIs, testing and treatment, HIV testing, breast and cervical cancer screening, abortion, pediatrics, and adult primary health care. We also do consulting and provide, PrEP and PEP medications. And we also provide gender-affirming healthcare services as well. And all that in addition to the health education that we provide, both in the schools as well as in the community. Next slide, please. Cool. So this is like the big history piece that I was talking about earlier, and it's pretty cool. I mean, a lot of this happened before maybe some of you were born, and I was a little kid when some of these things were happening. So a lot to learn, but it's great, to know that a lot of this work was happening here in the Valley. So in the late 90s, Planned Parenthood was the first community-based health center that provided rapid HIV testing using urine. So like a decade later, now we use a finger prick to do rapid testing, and you'll get your results in like 20 minutes. Like I mentioned before, our health centers provide PrEP as well as PEP. And we also had some staff members that were involved on a bigger level, more systemically. And we had some staff members that were co-chairs of the Fresno County Community Planning Group, which developed the HIV and AIDS prevention and treatment plan for the County of Fresno. So all this happened in the 90s. And then in the late 90s and early 2000s, here locally, Planned Parenthood, we rolled out some pretty cool programs to help address both the lack of information and the misinformation, as well as, just basic resources. And a lot of that had to do was that we were finding that, our rural communities here in the Central Valley were really being left out of the conversations and a part of the process to try to address some of the issues that we were seeing, right? And Kiana went over some of the statistics, right? So that kind of led us to have like a promotora type of model back in the day. So we had a few groups. One of them was called Proyecto de las Comadres. So Socorro, who is our public affairs director here, she was one of the educators for that program, and we worked along with the Fresno County Health Department, and we were able to receive some AIDS funding to support some of that work. We also did the Sisters Project, which was working with the sex industry workers, both in Westside County and here in Fresno. That was also in partnership with Fresno County. And then we also did the Village Leadership Project, which was in Kern County. And that was working closely with African-American churches to train and support folks in their communities as well as each other. Next slide, please. All right, and these are some other things that we did as well. So there was another Proyecto de los Comadres y los Compadres in Tulare County. So that was a 6-month contract with Fresno Planning to try to educate and do outreach to immigrant farm workers and provide them access for HIV AIDS testing in addition to prevention services. We also had a drop-in center. So this was a more harm reduction program funded by the State Office of AIDS. And it was used to engage the LGBTQ community as well as like just homeless youth between the ages of 12 and 24. And just kind of learning about what's going on, right? How to protect yourself, how to protect each other in regards to HIV and AIDS. And then lastly, between 2001 and 2007, us here in California, and we worked with folks in Mexico on a health initiative. So we did some binational HIV and AIDS work as well. So I just wanted to share that with you all. I thought it was really cool finding out that we were a part of the conversation and we were at the table here locally. But we're still here and we're here to support, and we're still providing a lot of services at our health centers and a lot of education. We're doing it more via school sites, but we're always open, if available, to do presentations, whether it's to a community group or to your class. You know, just feel free to reach out to us. And if you want to, you know, learn more about our services or make an appointment, you have the website right there. I'll drop it in the chat. And you also have an email where you can reach us. It's more specific to this region, but just feel free to reach out and we'll connect you to some resources or give you the information that you need. You could also give us a call if you want to set an appointment or just, you know, learn more about what type of services we provide. So yeah, thank you all so much for having me. It was a pleasure. This was really, it's making my heart feel really warm, and I'm really grateful to be here. So I'll just leave it at that. And if folks have anything, feel free to ask or, you know, drop some questions or comments in the chat, and I'll be looking out for those. Thank you.
Awesome. Thank you so much, Ernesto. Important that we highlight the organizations and the history of, you know, what this looks like in Fresno. And I did want to add that there are, you know, as well as Planned Parenthood, who does amazing work within prevention, education, and testing. But we also have some other organizations that do have a very large influence within our community. So, oh, I accidentally opened the website. So that's how you open the website. Sorry, next slide. So this event was put on, this event that you're here today, was put on in partnership with Fresno EOC LGBTQ+ Resource Center, Fresno Barrios Unidos, and KISS, which is a subsection of Fresno Barrios Unidos, as well as the student organization helping undergraduates get sexually safer. So these are all orgs that do really amazing work within health education and prevention. So these are some things to look forward to. So we have a free HIV test kit distribution. It was going to be tomorrow, but unfortunately with the new closures and, you know, we kind of have to rethink things, but no matter what, we are getting these test kits and we're gonna get them out to y'all. So I just encourage you to follow us on social media. It's at Fresno State CCGC to make sure that you are kept up to date to, you know, how we're gonna get these HIV test kits. They're completely free. Essentially, you take the test kit, you take the kit at home, and then you'll have some resources that will help you follow up if you do get a positive or if you get a negative. Another great thing to mention, and that of course I learned from our peers from KISS and Fresno Barrios Unidos, is that Fresno State, the Student Health and Counseling Center, does offer PrEP. So again, PrEP is pre-exposure prophylaxis. It's what you take when you are HIV negative before someone contacts HIV. And essentially it just gives them the opportunity to stay HIV negative. And so this is a really important medication, and we have access to it in our own health center. So that's really awesome. There are some other organizations that you can go to, of course, to get tested, including Planned Parenthood, or to get access to PrEP or PEP. But this is something that is on campus and is really interesting. And so we do have a bonus video, but we don't have enough time. So I'm gonna leave it at this, but I do want you to you know what, I'll send out, when I send out the assessment, I'll send out the link to this video. It's a new HIV patient meets a survivor from the 80s. So they're both living with HIV. It's really, really interesting. And I really encourage you to watch it. But, oh, I accidentally played it. Whoops. I'm gonna go ahead and leave us here. I really encourage y'all, I would like to say it's mandated, but we're on Zoom, so I can't not let you go until you take it, but please take the assessment. Esteban has dropped that in the chat for us. It's really short and it's really easy, I promise. It's completely anonymous. We're not going to share out your identity or the results with anybody, but it is critical that you take this because it essentially allows us to continue doing LGBTQ+ programming on campus. And with that, thank you for coming. Thank you to Ernesto and Planned Parenthood Marmonte, as well as our co-collaborators, Fresno EOC LGBTQ+ Resource Center, Fresno Barrios Unidos, and Helping Undergraduates Get Sexually Safer, the student org. If you are interested in joining Helping Undergraduates Get Sexually Safer, I encourage you to drop either your information in the chat or just say me, because I did kind of I snuck through who was our participants today, and I saw that Dr. Sullivan is here. And so we'll take down your information because it's a really great group that's doing some pretty great work. Are there any questions or comments that anyone would like to leave us with? About like either getting involved, getting tested, getting access.
We have a member who said, thank you for having me. I learned so much. And then another person mentioned, oh, thank you, exclamation mark. So thank you. You had to emphasize exclamation mark.
Oh, and I did get a private message that says, will you be emailing the recording to participants? Sure, yeah, I don't see why not.
Kiana, would you like to drop your email on the chat box so folks can request that video, or you want me to drop my email? Totally up to you.
Oh yeah, I can drop my email, that's okay. I also have a private message that says, what type of help are you looking for? So with the CCGC, usually we have a pretty robust volunteer program that I help oversee. Of course, with COVID, we don't really need the manual labor that we usually do, but I do encourage y'all to get involved with both helping undergraduates get sexually safer, so HUGS or KISS. KISS is I don't want to call it an internship program if that's not what it's called, but it's basically an internship program where you're able to spread health education and helping essentially the campus get sexually safer. And there is a stipend that comes along with it. So it's a really great experience to work with Fresno Barrios Unidos. If you need some extra experience within the field, or if you are just looking for, some part-time work, like that would be a really great way to get involved. So I'll make sure when I send out the assessment that the recording's included, as well as like the links to how to get involved with these student groups. And then I dropped my email down there as well. Any other questions? Okay, cool. I'm gonna stick around just for a few more minutes. So if anyone wants to ask me and Esteban something privately, feel free to stick around. But thank you so much for coming. Please take the assessment. Yeah, awesome. And feel free to stick around if you have any questions.
Thank you. Have a good night.
Thank you. Thank you. Have a good night.
So now we have folks thanking you, Kiana. I learned a lot about prep and PEP, and the difference. Thank you. Thank you so much for all the work you do in community. And thank you. It was very informative.